Thank you very much for all.
Today, it's our great pleasure to introduce Professor Dr. Suad Khalil Al Jaouny. Dr. Suad is a professor of hematology and pediatrics at King Abdulaziz University, and she will be introducing us to the Saudi experience in the effect of endocrine complications and its morbidity in thalassemia major. Professor Suad, تفضلي فندم.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's really my great pleasure to be here in my home, and I would like to thank the organizing committee and the kind the chairpersons, and special thanks for Professor Amal Bishlawi. She is the one, if she asks something, nobody can say no. Really, Professor Amal Bishlawi, she is a leader in hematology, and everybody proud of her. She has dedicated over years for improving the quality of her patient. Today I will talk about two things: the Saudi experience in endocrine complication and its morbidity in thalassemia, and also the correlations with the international network of clinicians for endocrinopathy in thalassemia and adolescent medicine. Everybody knows how improvement in the management of thalassemia over the last 50 years, but still there is complications, and we need to address today one of the complications, which is endocrine dysfunctions. Everybody knows all the complications coming from iron overload, suboptimal follow-up, and suboptimal transfusions. Everybody get to be concentrated in all the abnormality of endocrine. Our objective, just to see the prevalence of endocrine complication among thalassaemic patients, and it was done over 14 years. Other things would like to see the endocrine complications like on teenager and children. Everybody knows thalassemia major, it's a chronic illness. We divide it to three phases: children, teenager, and adult, which is very important to look for all these phases. Also, we have like a lot of things about the quality of control. We concentrate how's the quality of your patient. This is our hospital. It's an academic tertiary center. The first study will present today two retrospective studies. The first, the survival and disease complication. I will not get through all the complications, just the endocrine complication. As usual, we have less preventive program, so it's the majority of our patients is children and young adult and teenager. Here, if we notice here, the disease complication among 278 patients over the 14 years. If we look, the endocrine complication goes with age. Like the higher the age, the more complication, and the serum ferritin, the higher, the more complication. This is, we have 27 patients died over out of 278, and we look for the endocrine complication. It's the third cause of death. The second study, it was done in our hospital among two departments and between children and teenagers. We study 143 patients between 2006 and 2010. As usual, will be the same, and everybody shows like vitamin D deficiency is the highest, then preportal delayed hypothyroidism, short stature. This study gave us the clear follow-up in our patient. So the other study, you will not see vitamin D deficiency the highest, and pubertal or growth hormone or diabetes mellitus. So as usual, vitamin D, and this is a preventable disease, pubertal delayed and hypothyroidism, all can be treated and prevented. Only 7.6% has no endocrine complication, which is too little among our population, but this is in 2006. So we have observed like almost half, 45% had 3 or more endocrinopathies. So it's a common complication, should be addressed. The lucky in our center, we have multidisciplinary approach. We have 15 or more subspecialty looking after our thalassemic patient, including the endocrinopathies. So the things with multidisciplinary approach, it's a good and early detections, so you can prevent or control the disease complications, a good chelations, and should be, if we have a patient who had HLA matching, right away we send him for bone marrow transplant. And to control the disease, you'll have excellent quality of life. We have started collaborations with the international network of a clinician of endocrinopathy and thalassemia and adolescent medicine. These collaborations, it was initiated by Professor Vansos De Santi. He is from Italy and from Qatar and from Egypt. And they did excellent job. We start to share in this endocrinopathy network in the 4th Ban Arab, and it was in Abu Dhabi in 2015. Then, if you see here, about 16 countries collaborated, 16 medical countries collaborate for preventions, which is really good. And I prefer all the chronic diseases, like more clinical attachment, more clinical collaborations will be improve the quality of life of your patient. This is what it was done. It's a big workshop joined with this network of endocrinopathy, and it was successful. We publish a lot of publications. The publications, it's really in almost all the endocrine complications. It put for diagnosis, the setup, and the guidelines. Even we go beyond children and adolescents, we go to adult patients. All the time we'll put the diagnosis, the recommendations, which is very benefit in the clinical practice. The last publication for us, it was like everything about thalassemias, like the molecular to the diagnosis, different kind of countries in the world. So like the benefit of collaborations with 16 countries, it's really in research, it's a good thing for recommendations, diagnosis, and to improve the quality of life and give a message to improve how you do with your patient. Thank you very much. This is the reference. So I'll hold searches. Thank you.
Thank you very much, Professor Souad, for a very concise and concentrated presentation. Any questions from the floor? Questions? May I have a question for Professor Souad? Professor Souad, I have two questions, if you don't mind. The first one is about vitamin D deficiency. You said that most of your patients have vitamin D deficiency. I have noticed in Egypt that people normal without thalassemia, many of them have vitamin D deficiency. Have you made any comparison between the normal population percentage of vitamin D deficiency and thalassemia patients?
Yes. We all our study with control,
Yes.
but we found in thalassemia is more. The problem with thalassemia, you have the expansion of the bone marrow on daily basis. And usually they have poor diet and they have poor exercise. They have all the bad factors. And everybody knows how vitamin D, even if you have a good diet with the contamination of chemicals in the planet, make all the vitamins polluted out. So now, like, it's mandatory for all our patients to be like, if anybody will do pre-test and follow it up through his life.
Okay. The second question is about pubertal delay. What's your protocol for the prevention and the treatment of pubertal delay in thalassemia?
Okay, as I said, we have pediatric endocrineopathy and we have adult endocrineopathies. So with pediatric, he is the one who will refer the patient. For him, he will do the assessment and he will start the treatment. So if he had the luteinizing hormone or follicular stimulating hormone is doubt, and he did a panel of tests, then he'll start the treatment.
Okay, thank you very much, Professor Souad.
Thank you.